arthritis is increasingly common as we age.
It's pain, it's stiffness, it's inflammation, it's all that. But it can be, I think, a little bit more debilitating for people just because they notice it more, it bothers them more when they're trying to sleep. There's not really anything you can do once it gets bad enough to kind of rest it.
The way to fix it is through surgery, either with a partial or total knee replacement.
Taking what little cartilage is left and kind of resurfacing the joint instead. So now you've got kind of metal and plastic rubbing on each other instead of cartilage rubbing on each other.
Those surgeries are now better than ever, thanks to the ROSA Robotic Surgical Assistant.
A lot of the surgeries still, me and the assistants and my hands and that sort of thing operating the tools. And this is more of kind of an extra assistant that kind of helps guide where everything needs to be.
The biggest advantage of the ROSA machine is the accuracy and precision. Doctors can make changes of up to 0.5 millimeter in real time.
People just say it feels more normal. So, even though it's an artificial knee, they say it just feels more natural compared to previously. And then I think the recovery time period is sped up quite a bit.
Allowing patients to get back to doing what they love.
You can do anything after hip or knee replacement. I mean, there's people that ski and run and play tennis and golf, and there's really no limitations afterwards as far as what you can do.
For Lee Health, I'm Devin Turk.